2, 1. All right, I'm Mike Callahan. I'm one of the directors of nursing, and I'm with Melissa Compton. Both of us are going to be on vacation when you see this, but we will not be together. We are separate. So Melissa is on vacation, so we wanted to give her an opportunity to discuss when Corinne was able to shadow her, and she was able to shadow Corinne. So Melissa, if you were to describe the experience, how would you describe it, and what were the things that stuck out to you as valuable?
I had an excellent day with Corinne. I guess the most valuable thing that I got out of this was the fact that I could view my leadership as a nurse. She's a nurse, she's one of us. She joined us in clinic, she jumped right in, she actually cleaned a room, turned over a room for a patient. I didn't expect that, but she had, she didn't appear to be any better than any of us, so I was impressed with that. She really observed the communication in the clinic and gave feedback on that. I think it was good for the other staff nurses to see her in scrubs, here on the unit, partaking in the care of the patients. She observed a couple of our procedures, and I think it will help her better understand maybe the ambulatory nursing role, and maybe give some insight to the new ambulatory model, having actually been in the clinic and see how things run. And then when I went with her to observe her position, really overwhelmed with her schedule. It looked like it was every minute of every day is scheduled, meetings. And I did ask her, when do you have time to do the brain work, the thinking, the getting the work done? And there was a little bit of time on a Friday that she said she would do that, but she's a very busy lady.
Yeah, absolutely. So how do you feel like this experience will help bridge the gap between staff and senior leaders?
I think it's really important to be visible to the staff, and by her being present here in clinic, other nurses made comments like, "Wow, that's really nice of her to take time out of her busy schedule to actually come and see what we do." I think that's very important, and it was nice for me to kind of see, well, what does she do? You kind of have a mental picture of what your administration does. She's pretty busy. So
Yeah, I think it is valuable that each of you get to see and appreciate the work that each other does, because sometimes you're not able to always do that. So,
right.
so the final question, do you have any parting thoughts or anything that you want to say prior to us wrapping this up?
I would love for this to continue, the shadowing experience for other units. I think it just helps with administration's decision making, having walked in the shoes of the nurse in that area, and even allowing us to observe the administrative role. I think there's a better respect for one another that way when we have that opportunity.
All right. Well, thanks so much, and enjoy your vacation.
Thank you. You too.
Bye.